people who had their own plans or were in small group plans or even in plans provided by big employers and even self-insured employers to keep the plans they had.
Why would those who work for big employers, let's say?
Well, because certain rules. All of these employers had to provide insurance for your child until your child reaches 26. All of them had to eliminate caps on annual and lifetime payouts if you get sick.
They've already done that, haven't they?
Yes, but when those requirements were put in 2010, it made it impossible to, quote, grandfather those plans because the insurers or the self-insurers had to collect the money from somewhere. Those are expensive benefits.
So what happens now?
So now you're going to see the other shoe drop. You've heard about the millions of people in the individual market who have gotten letters that their plans are canceled. In the next year, many, many millions of people in the small group market and even who work for large employers are either going to lose their coverage or see it very much change.
All right, so where do they go? Now, I've always argued whether they go to private exchanges or public exchanges, if they're used to what they have through their company, they're not going to have it. So that's a big adjustment.
Very different, but the exchanges, the Obamacare exchanges, are very different from what people who have had private health insurance expect.
But even going to a private exchange is different dramatically from what a lot of these folks are getting used to. And they don't see that coming.
But let's look at these public exchanges because the president has said they'll be better, that what you have now is substandard or cut rate and this will be better. No. You will not have access to the doctors and hospitals you currently prefer. The law says that these public exchanges must depend on essential community providers who serve the low-income population. So they have to deal with the hospitals and doctors in the inner city, hospitals and doctors that charge Medicaid rates, and that's what your doctor, your hospital is going to be paid under these plans. So what happens
a year from now with the employer mandate kicking in?
I'm not sure it's going to ever kick in, because don't forget, the administration quietly delayed it after they tried to get the NBA, the NFL, to woo young people into the exchanges. Their last ploy, their last desperate strategy was to postpone the employer mandate so people who had to have health insurance and weren't going to get it from their employer would sign up on the exchanges. The last thing they're going to do is implement the employer mandate when no one's signing up yet on these exchanges. And
so
you've heard Nancy Pelosi say,
workers?
Well, it means that many of them will lose their on-the-job coverage and have to go to the exchange. Don't forget, the Congressional Budget Office told Congress before they ever passed this law that fewer people would have on-the-job coverage after this law is passed than before it was passed. Only Washington would develop an employer mandate that reduces the likelihood you'll keep your insurance.
Amazing. Amazing, amazing. Betsy, thank you. In the meantime, my next guest provides health coverage or tries to 13 of her employees. Now Dr. Courtney Dunn has to tell them they can't keep their current plans, much to what Betsy was just saying. Doctor, explain what happened.
Well, we got a letter in the mail just last week that told us that our plan has been canceled and that we didn't make ACA requirements, and that the new plan through Humana that does fit all the ACA requirements is 60% more.
All right, so they at least told you the alternative. There was an alternative, but it would cost you a lot more. So